Hi, everyone. So sorry to start a little late, but I really appreciate you all hanging in there with us and being here as we discuss a really important topic today, the use of artificial intelligence in research and what does that look like going forward. So we have a fantastic panel today. So I'm going to ask each one of them to introduce themselves. And we're going to start with the first person on my screen, Dr. Ben Brooks. Ben can, oh, no, he says don't start with him.
I
Too
already
bad.
knew where you were going with this when you said that first person on your screen. So my
Well,
name is Ben Brooks. I'm obviously related to the other Dr. Brooks, and my background is I have a PhD in molecular biology. I have done quite a bit of molecular modeling, and so I guess that's my expertise in this space. So.
thank you. And then Lynn Stevenson.
Hi, everyone. My name is Lynn Stevenson. I am library coordinator here in Utah. For research support, I work with students and faculty on typically the Utah and Colorado campuses. And I guess my expertise in this, or pseudo expertise perhaps, is that you can't write a research paper without AI these days. And I think what we really need to, so there's that aspect of literature searching and things like that. But I think what we have to get into is what role does generative AI play in research?
Wonderful. Thank you, Lynn. Student Dr. Lizzie Olson is the next on my screen.
Yeah, hey everyone. I'm Lizzie Olson. I'm a second year student here. Along with Lynn, have kind of a pseudo expertise, I guess I would say. I am a member of the digital health track here at Rocky Vista. So a lot of the information that I've learned about AI and a lot of the use I've had with it has been through the digital health track here, which has been amazing. And then I've also been working on a research project with a few other osteopathic medical schools as well, trying to understand where the osteopathic schools are in terms of adapting policy and curriculum and kind of what role that will play in medical education.
Thank you, Lizzie. And then the next person on my screen is Dr. Randy Anderson.
Hi, I'm Randy, and I'm a radiologist by trade. I've had an interest in digital technologies for some time. Obviously, that's sort of built into radiology to a certain extent, but I've also had a little more interest in even the average radiologist. And I'm glad to be here. My actual next job that I'm preparing for will be as a informatics officer at a hospital, and one of the tasks that they've given me is the exploration of AI. So this is a good beginning point for me to be talking about these things.
Thank you. And I don't see our last panelist, Dr. Brad Thornock. If you are on, please speak up. If not, then we will move on. Okay, it looks like we're going to miss Dr. Thornock. Hopefully he'll be able to join us soon. But I've chosen each one of these individuals for a very specific reason, because I've had conversations with them about AI and about what is AI going to do to change the face of research. And do we fight against it? Do we adopt it? Do we put policies in place? What do we do with AI? And so that's our discussion today. So I'm going to ask each one of our panelists, and I did hopefully give them a heads up. Hopefully you saw the email last night, about the main question is, what are your thoughts on the future of AI in research? Who would like to start with that? Actually, okay, no one's speaking up. So I'm going to choose. And I am actually most interested to hear Lizzie's perspectives. Oh, Dr. Thornock, you're here. Lizzie, before you get to that, I'm going to ask Dr. Thornock to introduce himself, and then we'll go on to that. Thank you so much. Dr. Thornock, will you introduce yourself and how did you get involved in this crazy AI discussion?
Sure. And sorry, I popped on late after the initial hiccup. My Zoom just decided to freak out completely. So I
We get it.
apologize for being so late. So, yeah, as was said, I'm Dr. Brad Thornock. I am the resident bioethicist for kind of both campuses of RVU, which means I cover all sorts of ethics discussions and education here. I have been interested in the ethics of emerging technology from the very beginning. That's what I kind of have always studied, which means I've been really into AI, and I've published and presented on AI for about the last 8 years. So it's kind of fairly early on, before there was a lot of stuff being talked a lot about with it. And then as a part of that work, about 4 or 5 years ago, I joined the digital health track for RVU, where we discuss ethics every single week, especially when it comes to machine learning, AI, but also telemedicine, social media, all those kind of digital spaces we talk a lot about. And I have been the vice chair or chair of the IRB for about the last 5 years, is one of those 2 roles. Which means we've been facing some of the questions about research ethics or setting all these things up for a number of years. And that's what kind of brought me to the panel today to talk to you about some of the ethical considerations about AI and research.
Thank you, Dr. Thornock. I appreciate that. Okay, Lizzie, we're starting with you because I am super curious to hear a student's perspective on the future of AI and research. And before you get into that, as part of your perspective, I want you to define, what is AI to you? Because I think sometimes the definition is kind of wishy-washy.
Yeah, absolutely. So like Dr. Thornock said, we've talked a lot about it in the digital health track. It's been a huge kind of really expansive growth over the last couple of years. So artificial intelligence, I guess, really is just this sense of machine learning or deep learning, where you have programs that are built to, in terms of like generative AI, that are building knowledge based off of, other aspects in order to create what would be a machine's idea of what the human conversation would say, essentially. So if you're asking it a question, it's using information from many different backgrounds to kind of pull in and answer that question based on deep machine learning, without getting too much into the nitty-gritty and kind of diving in on a whole lesson. I'm sure someone here would be able to do a much better job of kind of explaining that. But for a student's perspective, it's kind of everywhere. So I think it's just so easily accessed that it can be implemented in so many different ways, whether that's, it would be super easy to pull up ChatGPT or Bard and say, I need to write a research paper, and it would write one up. And I think the really important part of it from a learning or an education standpoint, and I'm sure Dr. Thornock will touch a lot on this too, is if it's accessible, but we don't talk about how to use it correctly and appropriately, it can be super easily misused. So one of the big issues with generative AI is it's just pulling information from what it's been trained to learn and kind of what it thinks you want to hear, in a sense. So there are many opportunities where it can answer questions incorrectly just because it thinks that that's what the correct answer might be or how it would be worded. And as it's trained and whoever's building it, there can be different biases that are added into that system. And so it's really important, if you are using it, to be aware of those biases and be trained on how to kind of dig through that and figure out what is useful information, what is helpful, and how to use it appropriately. One thing that I've used that we learned about in the digital health track that I've found extremely helpful is called Open Evidence, which is a generative AI system, which I am in love with and have used it way too often. But essentially it's like ChatGPT, where you can ask it any question. It's trained more on medical evidence. But the thing that I think is the coolest about OpenAI that's different from ChatGPT or Bard is it actually will put in the sources that it gets its information from. So that way, if you see like a tidbit that it says, it will reference that, and you can open up that reference, open up that journal article, and see if even what they're saying is taken out of context, if it's accurate. So it allows you to use that information, but it makes it a little bit easier to kind of garner through whether or not that's useful, accurate, and helpful information. So if anyone hasn't used that, you should absolutely look into it. I love it. In terms of my research that I've been doing, we sent out surveys to all of the osteopathic medical schools and tried to gauge where schools are in terms of placing policy and curriculum. Like I said, if you don't know how to use it effectively and appropriately, it's very easy to misuse. So I personally think that by fighting against it and just kind of sweeping it under the rug is not the appropriate way to handle it, because it's here and it's growing, and it's going to be implemented in so many ways, and it can be a really valuable tool both in the educational field, research field, and the clinical field. So I think it'll be really interesting to see where the conversation goes in the next year or so. Based on what we found in the project, which will come out here shortly, there's not a lot that has been done across most medical schools. Most haven't even had conversations about talking about policy or curriculum. Rocky Vista actually is the only school, I think still, that has the 4-year curriculum for digital health. So I think it'll be really important in order to make sure that students and future physicians are able to use generative AI as a tool in order to kind of help improve their research, help get rid of some of the, the menial tasks that are in every day, but also not misusing them and putting out false information.
Lizzie, that was awesome. That was amazing. I think we could end the panel now and be totally happy. If anybody has questions, I should just say, please throw them in the chat or feel free to unmute and ask questions. We would love for this to be a conversation. Lizzie just put out some great information there. And you can see, I encourage everybody to have their chat open, because you can see that others, I chose 5 people who I knew did AI, but there are so many others out there who have tidbits of information. So I would definitely encourage that. McKenna, you have your hand up. Go ahead and ask your question.
Question about, so AI in general, how are you guys comfortable with AI as a whole, not and trusting it enough to not be something that's, I don't know, maybe this is the skeptic in me, but being kind of rigged to give a certain set of answers? Like, you ask specific questions, maybe they're controversial questions, and how do you know that they're not being swayed to be produce biased results?
That is such a great question. Dr. Anderson, I saw you unmute. You want to?
I'm just saying that it will be, for quite a while, be biased. So that will be that. The answer is it absolutely will be biased for quite some time.
Well, one thing that I think is super important that we do in here, and Dr. Anderson and I go rounds about this all the time, is it's really important that I think that you train or frame or prime or whatever. Like, I constantly do that with anything that I do. I set guidelines and boundaries. So I have it analyze test questions for me. I have it write drafts of papers for me. I have it do everything, but I almost always put in boundaries, because otherwise the hallucinations will just take over and you are going to spend a ton of time. And it's also just really wordy. Like, it drives me bonkers at how wordy like ChatGPT and Bard are. And so I constantly frame it, and I tell it, I want 7 sentences on this with the following guidelines. And if you do that, I find it to be much more accurate and much more predictive. So I'll like load up DSA in before I do anything with it. And I think if you start doing that and you get comfortable with that, it definitely helps.
And to add to what was being said, a lot of companies have put guardrails on their individual LLMs type projects, so like ChatGPT or Bard, so that it can't answer in particular way. So that is one form of control. Secondly, these are set up as prediction machines. That's what all AI is. It's trying to predict something. In this case, it's trying to predict something you want to hear or something that'll be convincing to you. As such, they are always going to, or at least as currently set up, always going to reinforce the status quo, because that's the only thing they can pull from. right? It can scrape the internet, it can scrape a large data set, and it puts things back together, but that's just restating the status quo. It will never iterate forward for us, because that's just not how they're set up.
Dr. Thornock, that's a great point. And I think that that brings up, I would like to hear Lynn's perspective from, what does it look like in the library realm, Lynn? How is AI going to change the future of library sciences? You're muted.
Sorry.
Okay.
I know, I just couldn't make it work. Technology. How it looks in the library world is, my biggest concern had been copyright infringement and misuse of information because of the way certain programs, I'm going to call them programs, are actually programmed. What goes in comes out. And so I was very worried about how are we going to deal with the whole copyright infringement issues. And looking into this and listening to some webinars, I think that there are solutions to this, and they're probably voluntary collective agreements where the producers of AI are going to have, or will hopefully form these agreements with the creators of the content in order to be able to use it. And so I think there are solutions to that, which it was too big for me to figure out how they were going to actually do this. And we have to, and we want to look at open AI differently than we look at this, some of these other programs that we're talking about, like ChatGPT and Bard and things like that. Because open AI is just that. They take, they scrape through internet. They don't observe copyright at all, and they take no accountability for what is available. And I think accountability is something that we have to think about here. But in prepping for this, I came across an article, a very lengthy article, by the way, called "So What If ChatGPT Wrote It?" And it was a compilation of different perspectives on AI use, positive, negative. There's 73 authors who contributed to this particular article. And one of the things that I hadn't really, I hadn't really considered so much was how it could make writing a literature review, systematic review, whatever kind of review you're writing, make it more equitable for everyone to participate. Because by doing the research and being able to, you pick your sources, you've done the research, you have the interest. We love to do the research. That's the fun part. But where I see so many projects get bogged down is when we have to produce that manuscript and actually get it out the door. And it was like, light bulb moment. We could be using, when we're having our students go through the whole process, why can't we be using some of these generative AI tools to help produce manuscripts, so that we can, not everybody is great at organizing information. They can tell you everything about this topic, but when they have to put it down on paper, it falls apart. And so I think some of the strength of AI is to be able to use it to make everybody on a level playing field when it comes to producing that manuscript. Also, when we're talking about some of this important information that we're trying to disseminate into the public, if we can produce a manuscript in a more timely way, we get the information out to the public, more whatever public we're disseminating to, whatever our audience is, we're getting it out there faster so it can be put into use faster. And it
Great.
gets, then it gets literature reviews always have to come before any other kind of research. So it gets to that next process quicker.
Great points, Lynn. There's a couple different things that I want to unpack and throw to the other panelists a little bit. One is Lynn talked a lot about bias and how it decreases the bias. And some of the other stuff that I've read talks about how it might actually be counteracting some of our DEI efforts for bias because it's pulling from biased information. So I would like, I'd like to ask Dr. Thornock to kind of weigh in on that and talk about what he sees as the future of AI.
Absolutely. And that's a huge question of AI. So we're going to actually look at it from a few different kind of lenses. Sorry, it's going to be longer than I'd like to with this answer. So first, yeah, there's just straight up bias. There's the hallucinations, but there's also bias in just what AI has access to. As we talked about already, it's going to favor the status quo. For some communities, the status quo has been horrific, and that's going to continue if we use this in a way that we don't think deeply about it. That's one form of bias that could come under this. A couple of things that make it really hard to root that bias out has to do with transparency of the AI. So some AI operates within a black box, which means even the developers don't fully know how it's making the judgment calls that it's making, and it can't explain it. And if they knew how to explain it, you wouldn't have to build the AI in the first place. So that's obviously like a fundamental problem for some forms of AI. Also, it's incredibly difficult to get a patent for software products. What that means is almost all AI and machine learning products right now are trade secrets. That means if you want to keep it a trade secret, you don't tell anybody about it. The more you have it out there, if somebody starts using it, then you don't really have a recourse there, which means many stakeholders that might have something to say about how this AI is producing the results will be left out because it's going to be a problem with trade secrets. That's a larger systemic thing that we're going to need to think about if we want to get rid of some of the bias that's inherent to some of these systems. And finally, what we're showing over and over again is even if you had all these things set up really well and you got data sets that weren't super biased and you were able to see how the machine learning was working together, you also have confirmation biases from reading the results ourselves. We're going to find things that we find most convincing are going to be the things that we find comforting and things that already match our worldview, and we're going to ignore anything else that doesn't do that. That's obviously a problem with all things, right? We will always do this with every result we get, but it's potentially going to be at scale, as I said in the chat just a little bit ago. That's the difference. This could be happening at such a high rate because AI can produce things so quickly that it's going to be really, really hard to kind of pull and tease these things apart. So there's a few different areas of bias we actually need to be on the lookout, from the machine learning itself to the corporations and how they're putting it together, because they're going to bias it toward whatever their consumers or people want, like the C-suite in a hospital, to the way in which we are consuming the data that comes out.
Fantastic. Thank you so much. McKenna, you have another question?
So maybe just if I'm understanding you right, when you're talking about like the shareholders and the people who are having the patents on this technology, it's limited. Nobody really knows what's going on the inside. And there may be do you mind repeating what you were saying about like what the shareholders were specifically doing?
Yeah, so there's several different ways that you can set up machine learning. Some that's called supervised, some that's called unsupervised, and that depends on how you're tagging it. In other words, like, what are you telling it to do or to give you, and how much control are you having over that? Some of these like larger systems that are just trying to find like patterns or develop things really quickly are unsupervised, right? We're not totally looking over their shoulders, which means we know the information that's going in, we know the information that's coming out. What we don't know is how are they weighing and how is it weighing and making all these decisions in between those 2 points. Sometimes it uses things that are really fantastic and we're okay with it. Sometimes it might not. There's a classic example of this from a few years ago. I think it was the University of Washington set up an AI system to be able to delineate between huskies, like pictures of huskies and pictures of wolves. And in the lab, it could do it at right around 90% accuracy, which seems pretty good, right? Because they look fairly similar. But every once in a while, it would just spectacularly fail. And they couldn't figure out what it was. And this one was slightly supervised, so they were able to go in with computer vision and see what it was really attenuating to, like what was really looking at really closely, right? And the dividing thing that the AI was using between deciding whether it was a husky or a wolf was if there was snow in the picture. If there was snow in the picture, it thought it was a wolf. If there wasn't, it thought it was a husky. What that means is we could get really high lab results from this, and it might be pulling on something, maybe even something racist, maybe even something sexist, or other things that we're not okay with. And it might be using that as a determining factor that we can't know. And that's going to be obviously a problem that's going to be something we have to be very careful about.
And is it something that like somebody has gone in and been like, oh, we're going to exclude this race of people from a study, or is it just like unintentional, like it's happening by accident?
The totality of the research that's been done that you can pull on for any things has tended to keep certain people out, which means it's harder, or represented them in ways that are not totally accurate, I should say, as well. So it's going to be a lot harder to tease that apart. If you're feeding it, imagine it feeding it just like all this information, but it was like early 1900s eugenicist information about what race is, right? We would not like anything that AI has to say about that. Now that's really obvious because that's 100 years ago, but it'd be a pretty hubristic of us to assume that 100 years from now, they're not going to look back at something we think is just every day and think that's awful, right? So we have to be really careful about that. It's not like there's not just like one bad actor out there like, I'm going to do this. It's the totality of the system, which makes it so much harder for us to actually root out.
That's awesome. Thank you, Dr. Thornock. And thank you for that example, because I think that actually goes to one of Lizzie's points. And I want to ask Dr. Anderson to comment on this, because Lizzie said, this is a great tool to help us automate some of these things that could be a little more routine. And then Dr. Thornock gave that beautiful example of the huskies versus the wolves. And that made me think of one of the ways that I have often thought about one of the things AI might be able to do is read radiograms. So read some of the imaging. But Dr. Anderson, do you think that's feasible? Is that a thing?
Yeah, I mean, it's happening. I'm going to send a couple of links here, and that'll be better than me talking too much about it. But so there's one to River Rain, one to Page AI. The one is radiology, and the other one is pathology. They've got some impressive results. The challenge will be, sorry, I'll try to keep this quick because there's obviously too much. But some of the things I wrote down was just as far as imaging research, just to give an overview, because we won't have time to go through a lot of stuff. But I wrote down some notes saying research, the purpose is to better our lives. Medical imaging is often a focus of this because, a focus of AI, because our data is almost now completely digitized. That's not completely true, but most of medical imaging is now in the digital format, so it's ripe for AI. But just for history's sake, they were using AI in the 1960s to try to determine bone tumors on X-rays. And as of 1998, we had our first CAD, computer-aided diagnosis for mammography. Mammography is easier, let's say, to recognize than other places because there's limited types of tissue in breasts compared to the rest of the human body. Anyway, so it's been out there for a while. There's lots of different types of AI, but the power of AI becomes proportional to the computer processing power. So just like imaging has improved, I mean, like CT and MRI have improved drastically because of the increase in processing power of computers, and that's the same thing that's happening with AI, right? And so the principles have been around for a while, but we're just getting the power now to be able to use them in more powerful ways. So just one general or two general thoughts, I guess I'll end with, and then you can tell me whether I even came even close to answering your question. My opinion is that AI in imaging will slow things down before it speeds things up. And that's because with humans, emotions are involved, and we can ask about what intelligence is and how radiologists make their decisions and things like that. But if you start putting a bunch of marks on films for radiologists, it's actually going to make them less confident at first. Because they're going to have to, instead of being able to go with their gut instinct, they're going to have to stop and question, what it was in their years of experience made them decide to ignore certain things. And a lot of it ends up being done subconsciously, right? And so if you bring that to the conscious level, it's going to be a tough decision for a radiologist to decide whether they're going to trust themselves or trust the computer. And so there's going to be actually probably a lot more follow-up. It's probably going to be it's probably going to increase the expense of medical imaging at first rather than improve it. Eventually, though, I do believe that as things get better and better, and if you look at some of the results of Page, specifically Dr. Fuchs from Germany, he's got some pretty impressive results. And if I was having my Pap smear read, for instance, I would definitely want to not that I would be getting a Pap smear, sorry. But if I was a woman having a Pap smear, I would want it run through that AI because it's impressive. And then the final thing I'll just end with is just the incentives involved, because coming back to the idea of research, unfortunately, just like everything else that happens in the real world, it's not all altruism, right? And I know Dr. Thornock knows this because I've sat with him in some digital health meetings. And you've got a lot of incentives that are pointing AI to certain uses and certain directions that aren't necessarily the best for medicine, the best for patients, but because there's a big greed incentive involved with this. And so I'm giving you two answers, and I apologize, they may seem opposite, and that is that yes, this is going to happen, and it's going to be impressive, and it's going to be very helpful, but it's going to be a very painful process.
I love the fact that you gave me two answers, because I think that's why we're having this discussion panel, is because it's not clear cut. And it's never clear cut anytime we have new technologies. Okay, now Ben, I'm going to throw it over to you, and I'm going to ask you to talk about your use in AI to look at some of these huge data sets with the VAERS database and how you see it being used in the future. And then I'm also going to ask you to talk a little bit, because you talked about how this can really kind of push forward some of the manuscript preparation. And you and I have had that conversation, and Lynn mentioned that. So I'd like you to comment a little bit on that too.
Yeah, so one of my colleagues that I've worked with in the past at Dartmouth was, he and I had a really big problem with protein structure relationships. And just recently, because of all of the new machine learning algorithms, we're starting to get some of these really complex problems based on, they were just throwing data set after data set into the hopper of the algorithm as a training tool, and they're starting to figure out some of the most complex problems that we've ever faced in protein structure. It is just popping out, and I think that there's going to be several places that this is going to be super important, not just in protein structure, but genomics is going to blow up once we start putting in these data sets, like all of us, into machine learning and start identifying, because some of the problems that we face, we have such low prevalence of these things that all of a sudden with with different groups of people, you're going to be able to have them in ways aggregate the data in ways that we never have had possible, and so I think we're really going to start seeing that. We also are going to start seeing connections that are very challenging for us to put together. So one of the projects I was working on with a student was on Marfans, and we were trying to figure out how to link TGF beta to back into some of the other protein structures that we were working with. And so we just asked ChatGPT to tell us, and we obviously really needed to spend some time validating it, but it gave us several pathways that were theoretically possible, and we were able to go through and actually connect them up and put them together. So these large data sets are certainly things that are amenable to us figuring out problems that we as humans are just not capable of putting together all the pieces. And so I think that's definitely something in research that we're going to start. That's another avenue that we're going to start seeing come together and change how we do what we do. So and to the point of how do I use it, I no longer write very much myself. I almost always start with something that comes out of ChatGPT. I prime it, and then I put in my paragraphs, and then I just go in and I just start adding. I almost just start editing right away, and I hack it. Believe me, I don't, because I find that I write better when I am editing versus just from nothing, from scratch. And in fact, I tell students that too all the time. ChatGPT is not a good writer. It's horrible, actually, but it does give you some place to start. So that's how I generally use it, and I use it 6 to 8 times a day for all kinds of stuff, from test questions that I need modified, or I want to get a perspective on, all the way through connecting dots on things. And I wrote an entire paper with ChatGPT just by putting my thoughts down and just dumping it in there. It spit it out in less than an hour. I had a full draft in less than an hour. So
I think that's such great advice. Thank you. I appreciate that. But the one really critical piece, and then we'll get to McKenna's question. Actually, I've got Chris's question first and then McKenna's question. And this kind of goes to Chris's question is, a lot of the ethics committees and stuff has been suggested that you can't just trust anything that ChatGPT throws out. You modify it, you verify it. And in fact, most of the journals say that AI cannot be an author because it can't take any responsibility for what it's writing. And so if you use AI, you are still saying, I agree with what AI is saying, and I agree to take responsibility for that in the authorship discussion. So that goes directly to Chris's question here. And I'm going to ask, actually, I think probably Ben, Lynn, and Lizzie to weigh in on this. Do you think young researchers should be careful about using AI to assist with publication? And just as a follow-up, would the results reflect badly on the researcher who used AI for a large portion of their paper?
I think yes and yes.
Okay, great. Lynn, what do you think?
Yes and yes.
We're reaching consensus. This is amazing.
I will say that they are publishers are recognizing the fact that AI is being used.
Yeah.
And so rather than and it will tell you in author's instructions that you may not list it as an author, but you need to talk about it in your methods section
Perfect.
of your paper.
Yep, I think that's awesome. Thanks, Lynn. Lizzie, what do you think?
Yeah, I agree. I mean, like Dr. Brooks said, I've used it a bunch I always have a hard time getting started when I'm writing anything. So I think it's really helpful to just get kind of like a layout of how do I want this organized, and then either chopping or using that organization to start on my own and do something on my own. But like we've talked about, I do think you have to be very careful with being very diligent about editing and going through and making sure that what is in there is what you want to say and is not misrepresenting what you're saying or all out false. And I do think there's just a lot of hesitancy, part of why we're having this talk on using AI in general, and still a lot of pushback. So I do think that in some instances it could be looked badly on for using. So I think there just has to be a lot of care and caution. And I hadn't heard about having it in the methods, but I do think that would be a really great way to kind of include that.
Yeah, thank you so much. I think that that's super important, Lizzie. It doesn't absolve us of critical thinking. It's like, and the fact that we reached consensus in a meeting with 60 people, I think we should call this a successful day, you guys. McKenna, go ahead with your question.
Sorry, real quick, can I jump in? I know it's expressly
Absolutely.
not allowed to talk on that last, but
No,
one
you
thing,
are totally
I'm just joking. One thing I failed to mention earlier, I'm actually the chair of an AI task force for RVU, and we're trying to set up the guidelines for how you can use this for paper writing or other things in our institution. I know we're not the only one. There's lots of different institutions that are trying to set that up as to how you cite, whether you provide prompts that you're using, how you're going to do that. That's also something you're going to want to keep an eye out for. How does your institution want you to do it? How does the individual journal want you to cite it? And what evidence do they want you to provide for what you used as you're generating?
Thank you so much, Dr. Thornock. Really important reminders. Okay, McKenna, you're on.
So I know that Dr. Brooks talked about entering in data and using, I believe if I heard that correctly, and using AI to analyze data. How well does AI analyze your data, and how do you ask it to analyze your data? Like if you have there's a lot of different ways you could do that.
So one of the things that's really important to know is there's a couple things. First and foremost, and I don't want to pretend like I'm a huge expert in that, but I would say that the more data that you have, the better off it's going to do. And certain AI systems do much better with positive information, telling it to do something versus telling it not to do something. So as you're doing things, if you're really geared towards finding connections that exist, it will do much better than if you tell it, but don't do this. Like if I tell it don't include certain, like if I try to frame something as don't do this, it will almost always do that. And I don't know, well, I don't know why it does that, and why. I suspect that has to do with the algorithms, but I think that's the situation. One of the things that's super important, there are teams of people who put together these trainings for artificial intelligence, and so I don't know that it'd be completely accurate, or unless you have access to open data. Like if Dr. Anderson had a personal stash of radiographs with confirmed diagnosis, that would be a great source, but that's probably not realistic for most of us. And so I think that's where you get a lot of your good data sets and your good training information.
Thank you so much. Okay, so Anna has a question. I think we're going to end on this question, but you can see why our whole theme of Research Week is the use of AI in research, because there's so much to learn and so much to know. So I'm actually going to ask each one of our panelists to kind of weigh in on this question, because I think it's a really important question. Anna asked, do you think that using AI will become the norm, and students in the future who write without using AI will essentially fall behind or receive lesser grades than students who use AI? And I would also extend that to clinicians. So who would like to go first on that one?
I'll just say yes, they'll fall behind.
Okay. I appreciate those short answers. Dr. Anderson, what do you think? Clinicians who don't use AI, are they going to fall behind?
You just said you appreciated short answers, and then you called on me.
Ben gave you his extra time.
You know that those two things aren't compatible, right? No, I personally believe that AI, if I'm trying to give a short answer, AI is going to help us completely change our models of both education and clinical practice. And those things, we've been trying to do that through various methods for many years. When I was in medical school in the 90s, I was told that it was going to change. I came to RVU, I clearly saw that it hasn't changed. And I'm not trying to be critical. I'm just saying it was surprised me that it really hasn't, nothing's changed much, right? But AI will force that change. And I think it will be a good thing. Again, it's going to be a messy thing, but I think the change in the model of how we learn, how we grade, how we judge, how we think will all be changed by AI, and it will be for the better in the end after a lot of pain.
Thank you, Dr. Anderson. Dr. Thornock?
Yeah, I reckon that AI is very similar to something like a calculator. right, from back in the day. Like it's going to become ubiquitous. It's going to be something that you're going to be expected to do. What that means is it's not going to be less of like who chooses not to do it and who falls behind. It's going to be assumed you're going to be using it in the future as a student or clinician, and you're then going to be asked to do things beyond what you're normally asked to do so now. We'll have less assignments asking you for book reports because it knows the AI can do a book report for you, and hopefully more assignments about critical reasoning. You go in and critique what you've been told by the AI. Where is it wrong? Where is it right? Why? Right? That's a higher level. I think of like my daughter who's 12, who already has to have a calculator to start the math that she's doing, and is doing more complicated math than I did when I was 12, as a result of having that calculator readily available to her. I imagine that's how it's going to be in the next even 5 to 10 years.
Thank you so much, Dr. Thornock. Lynn, final thoughts?
No. I think I think I agree with everyone that it is going to change things, and I do think it's going to have our students functioning at a higher level than we sometimes expect of them. But when you get into the ethical concerns and a lot of these things that we've talked about today, I think it's going to be our job to help students learn to use this appropriately and effectively and ethically.
Yeah, thank you so much. Lizzie, final thoughts?
Yeah, I mean, I agree with what everybody said. I think that with how much it's grown, even over the last couple of years, we're going to see that same exponential growth over the next coming years. And it'll be used in ways that maybe we haven't even thought of how it can be used. So I think it will be really important to maybe, I don't know if students would necessarily fall behind, but I do think there is an importance to kind of start understanding how it's used, so that when things are applied in the future, you're kind of on the forefront of being able to use that technology or understanding how it should be used. And I honestly think that if people are doing that now, you could almost have a leg up because it is getting integrated so much into clinical skills and in education. So I think it will just be a very useful tool that will eventually be integrated into almost everything that we're using.
Thanks, Lizzie. I really appreciate those thoughts. And if you'll notice in the chat, we've had all sorts of conversations going on there. And Dr. Atkins said that it's going to be on all anesthesia machines before you know it. And Dr. Small said, hey, it's pathologists, they've been using it for years to try to read slides and scan slides. And so we've seen this all the way throughout. And Dr. Hallstrand put in there, this is going to change how we have to structure assignments and what we're asking of our students to do. So it's definitely such an important topic to think about how this is going to look. And I'm going to ask Dr. Thornock, because you guys all just did like short answers, which I appreciate, but now we ended a little shorter. I was so timed out, you guys.
Amanda, before you give it to Brad, can I clarify one thing? Is that all right?
Yes, please do.
Okay, just when I gave my answer, I realized it might have been too vague. What I'm talking about in the change of education is that this whole model of memorizing information, because we know that the data shows that medical students forget their medical school information at the same rate as nonsense syllables. We know that by studies. And so just the very idea that that's what we consider intelligent learning to be, is to who can memorize the most information for the test. That's what's going to change. And I think that will be a good thing. I just wanted to clarify that.
Thank you. I think that's a really important clarification. Thanks, Dr. Anderson. And now, Dr. Thornock, I'm going to ask you for final thoughts as the chair of this ethics committee that's trying to figure out what our policy should be. Final thoughts?
Yeah, I mean, this is obviously an exciting and in some ways harrowing world that we're opening ourselves up to. This is going to be something that is fairly inevitable that we're going to need to be thinking about. It's always amazing to me that if we would have been running this in October of 2022, we probably wouldn't be talking about generative AI. That really didn't pop into there till about December of 2022. That's how fast this whole thing, people had no idea what ChatGPT was a year ago, right? And now it's as a common parlance as anything else that we're talking about. What that means is we're looking about this as an institution. We're trying to find ways to allow students and others to have the space to use these technologies in an honest way, to not feel like they have to hide it, to not feel like it has to be something, you know, pushed into the corner, because that's when you have those ethical problems. That's when you have those issues, because if we ask students, okay, how did you come up with this information? And they feel like they have to lie, because really all it was they just copy and pasted it out of, you know, Bard or ChatGPT or even MedPalm 2. Like, we want them to be open about that. So we're trying to set up those systems that allow them to be open about that. We're also trying to protect you all from this too. One thing that hasn't been mentioned, I don't think quite enough yet, is that while these companies or other interfaces are doing a lot and bringing in a lot of information, one bit or one source of information is you as the user. These collect a whole lot of information about you as you're using them. Some things are kept private fairly well. Some things are kept secure fairly well, but they have already been hacked. People's information has already been gotten out from you just being a normal everyday user of that. We are aware of that. We're trying to come up with ways to allow students to safely use it that will not undermine their educational process, and to also be innovative, as one of our, you know, values are, in the way that we approach the curriculum all at the same time. That's not going to happen over the next just couple of months. It's going to be a long-term process as we set these things up. I think one of the first recommendations that the task force that I'm chairing is going to have is, we need a standing task force on this. Like, this is not a one and done thing. We're going to have to constantly be looking over this and adjusting as the technology adjusts, to keep you safe, to keep us safe, and to have high quality education and research popping out of our institution.
Thank you so much, Dr. Thornock. McKenna, I'm sorry we didn't get to your last question in the chat, but I would encourage you to go and listen to our keynote speakers on Friday, who will both be talking about ways that we can more effectively use AI. Lots of good information in the chat. Thank you to all of our panelists. We could not have done this without you. So much great information shared. Lizzie, thank you for representing the student voice on this. You were eloquent and well-spoken, and represented the students very well. Lynn, thank you so much for all of your input and wise counsel from a library sciences perspective. Ben, thanks so much for talking to us about how to use this to process data and really mine stuff. And Dr. Anderson, we appreciate your clinical perspective so much on what this actually is gonna look like from the clinic. And Dr. Thornock, thanks for the ethics. We always need that and have to bear that in mind. So thank you, all of our panelists. Thank you for participating. And we'll see you at the next event. We appreciate it. Have a good rest of your day, everyone.